Good morning. How is everybody? My name is Tim McKee. I'm the CEO of the Olathe Chamber of Commerce, and I would like to welcome everybody to our Friday Zoom call. Like many of you, I am operating out of my home during this pandemic and trying to remain safe. And so here at the Olathe Chamber of Commerce, we are committed to trying to provide information to our local businesses on not only how to remain safe, but also safely return to business. And today we have two guests with us, one from the state of Kansas and one from our county. And I'm going to let our lobbyist, Natalie Bright, here in a minute, introduce them. If there are any questions, we're going to allow them to provide information in regard to safely reopening our businesses. And if there are any questions, we have the chat mode that you can fill in messages that you would like to have our two guests answer once their presentations are done. So with that, I'd like to welcome you once again, and I'm going to turn it over to our lobbyist, Natalie Bright. Natalie, can you introduce our guests? Thank you.
Good morning. Thank you, Tim, and thanks everybody for being on the call. I am very excited to have our Lieutenant Governor Lynn Rogers, who will kick off this webinar and go over the plan that the state has put together. I will report that I believe most counties have adopted this plan, which I think is great for the state of Kansas. Some have a few different restrictions, but overall, and Joe O'Connor, who will be following Lieutenant Governor Lynn, will go over the Johnson County differences. But real quick, so everybody understands where Lieutenant Governor has come from. He's been involved in public service for many years. He started out as a businessman. He worked in the banking industry and the ag community, but then decided to run for the Wichita School Board, where he served as the president. He then had moved to the Kansas Senate, where he served before he was asked by the governor, Laura Kelly, to serve as her lieutenant governor. I've worked with Lieutenant Governor Lynn for many years. Lynn Rogers. I have a habit of calling him Lynn. And he's a great friend. He's always willing to open and listen. And so when we had this request of the administration to go over what the plan would look like, he did. Real quick, before we get started, I did want to reiterate that we are recording this presentation and that if you would like to turn your camera off, you may do so. And then secondly, that all questions will come through the chat. All mics have been muted, and that will just help for the flow of the conversation. We're going to have questions of the Lieutenant Governor first, and then we'll go to Joe Connor, and I will introduce him, and we'll have questions, and then Joe will answer those because our Lieutenant Governor does have some other commitments and will need to get off. So with no more ado, I'd like to introduce Lieutenant Governor Lynn Rogers. Thanks so much for joining us.
Thank you, Natalie. Thank you, Tim. And thank you all for joining me this morning. It's a privilege to be able to address you as well as to serve as your Lieutenant Governor. As you know, the last 8-10 weeks have been very unique and probably a period of time we don't ever want to have to live over again. But I have been very proud as how Kansans have stepped up to do the right thing for their friends, for their neighbors, and for their community. I know many of you probably have seen parts of the reopening plan, the Ad Astra plan, and if you haven't gone to the website, I would encourage you to do that, and that's covid.ks.gov, and there's a wide range of information, the plan itself, questions and answers, as well as other things that are very important for you to look at, for people to see. It also includes industry guidelines and things of that nature. And while we were in the process, everyone's staying at home, the governor's staff and governor started working on this reopening plan right away. And one of the things that we did was we tried to talk to as many industry groups and business groups as we could to find out what was important to them to reopen. We also studied the effect of previous pandemics similar to the 1918, and we looked at the communities that opened early and those that were a little bit slower. And what we found was, I believe it was Philadelphia and different places that opened really early, had a big parade to quote unquote welcome back normal, ended up having a huge resurgence of the flu and lost a lot of different people. So as we went through that, we wanted to make sure that we were cautious and that we were careful and not have a situation where that comes back again. The plan itself is 4 steps. We are currently in phase 1 that began, I believe, Monday at midnight. And phase 1 will go through all the way up to May 18th. And phase 2 will not open no sooner than May 18th. And what we're asking there is that, again, we have groups of no more than 10. Restaurants and some businesses can start reopening. But again, we're going to be very careful. Phase 2, we continue to watch that progress. That would be then 30 people. Phase 3 would be 90, and then phase out, which isn't really a phase 4, that would start no sooner than June 15th. And again, all of these phases and all of these dates are based on health metrics that we'll be determining. The governor will look with our state health officials, and we also have done a lot of work talking to local county health officials as well. But we look at the death rates, we look at the hospitalizations, we look at the spread of the disease. Are there additional clusters that are coming up? We're wanting to make sure that those things are under control. Some people are panicky because the number of cases that we're finding are going up. We're having a couple hundred or more cases a day that we're discovering. But that's not just because there's more cases. Yes, there are, but we're also doing a lot more testing. And, we've gotten finally what we feel is a somewhat adequate supply of testing. And as we've set this 4-phase process up, one of the things that we've looked at is how do we control if there is an additional outbreak? Do we have the resources to not only do the testing that we need, but do we also have the mechanism to do the contact tracing? And the KDHE, Dr. Norman, are putting together a team of some paid, but mostly volunteer contact tracers. They'll be looking at, if they come off with a new case, who are those people that are working on, excuse me, just a second. We have a repair going on in the building. What we're looking at, the contract tracers will, if someone gets a case, they'll go in and determine, they'll talk to those people, find out who they've seen and who they've not. And that's one of the reasons we're wanting to be cautious on this, is that people, oftentimes don't even, if they're at a party and if they don't know who's there, they can't even determine and be told that they've been exposed to COVID-19. So again, we've been trying to, most of this is just based on caution. We know it's important to keep this virus in check, and we're continuing to learn more things about this virus as well. And so that is changing. It's one of the things Dr. Norman mentioned this last week was, the number of people that have been testing positive but don't really remember having any symptoms, or if they were very, very mild. And so, but they're still carrying the virus and can spread that to other people. So, so those are some of the things that we're looking at. We're wanting in phase 1 to people to continue to minimize their travel, be careful as to who they go out and see, encourage employers to continue to do telework if they can, and in that regard. We're also asking people to wear masks, and that I know is controversial. People think that's a bad sign. Well, I wear it all the time, and when I'm out, and the reason is I really care about my neighbors and my friends and my family, and I don't want to spread it. And it really is, wearing that mask is protection for you, not necessarily for me. So so I think it's important that we maintain those issues and continue to do social distancing. Phase 2, no sooner than May 18th, we'll start opening some things up. There'll be, again, we'll encourage masks and social distancing. We want to continue some of the things. We'll move up to 30. There'll be additional businesses that can reopen. But I think, again, as I hear around the state, some people are still being very careful not just the business person opening their business, but the customer being hesitant to go in unless they know that business is doing everything they can to protect them and keep them safe as well. So phase 3 then would be, I believe, no sooner than, what's my date here? It's June 1, I believe. There'll be additional opening up there. We'll go to no more than 90. Again, everything we can do to keep personal hygiene in place, wash your hands, be careful on all of those kinds of things. Some more business travel can probably resume. If I tell people one of the things that I really miss, my favorite part of this job is travel and visiting Kansas. I think I've been to over 75 counties, and that has slowed to nothing. And so I really do want to get back out again too, but I don't want to make anybody unsafe. So, and then if we can get through that phase, and again, the health metrics are in place, we'll move into the phase out, which we haven't set a number for how large the mass gathering can be. But when we talk about these health metrics, the governor will actually start meeting with our Secretary of Health and Environment next week to talk about where our numbers are. And we'll be continuing to brief the public through the governor's press briefings. They're Monday, Wednesdays, and Fridays now as to where we're at with that. And again, we hope to give as much advance warning that we're ready to move from phase 1 to phase 2 and phase 2 to phase 3. So you'll see reports probably midweek before the next phase is supposed to begin to either say we'll move forward or we're going to stay where we're at for the time being. But again, the primary purpose is to stay safe, to minimize the number of deaths, and to keep our health facilities from being overwhelmed. One of the other things we've been encouraged by, besides the testing, we've been starting to get a little bit more supplies when it comes to PPE, personal protection equipment. That has still been a very difficult process. We started ordering, masks and gowns and face shields as a state. I think we have over $40 million of that on order. But again, because we were competing against all the other states and many cities and counties and the FEMA itself, those have been slow to come, but we're starting to see those come in and again, getting those out as fast and as soon as we can. So that kind of is I think the highlights that I have. I think the biggest thing that I appreciate, particularly what I've seen in Johnson County, is the concern for protecting their community and protecting, their citizens. So I appreciate that. I encourage you to, continue to stay strong. And again, if you've got questions, I'd be happy to answer them, as well as, if you have good questions after I leave, get those to Tim or Natalie, and they'll make sure that they get them to us and we'll get them answered for you.
Thank you, Lieutenant Governor. I appreciate it. I think one question that came in was, if there is a second wave, has the state started working on a plan and what that might look like?
We are starting to look at that. We don't quite know, what the second wave would look at. So we have to have a lot of what ifs. And so that is something that we're talking about. Particularly, there is some thinking that it could happen again in the fall. That's, again, one of the reasons why we're trying to put as much emphasis on PPE equipment and things of that nature. That's been one of the biggest reasons many businesses can't reopen, is they don't have access like other places do. For instance, barbers and cosmetologists, we've gotten some grief on that one, but, our mom and pop barbers and cosmetologists felt like they wouldn't have the same access to PPE that the big chains would. So that was one of their concerns about opening in phase 1. But again, going forward, if we have some of that, it'll make it easier to keep some of those businesses open in a different way than we did in this first process.
Great. One more question is, can you provide clarification of the 10-person limit? For example, if social distancing is observed, can more than 10 people be in a building during phase 1?
As I understand it, like an example of a church, if people, or in a restaurant, they can have up to 10 people at a table that already are together. So, if it's a family that has been socially distancing in their home, it's not 10 strangers at a table, and then that's the limit. They would be able to do that as long as that group of less than 10 is at least 6 feet away from another table or another group of folks, and that there is as little interaction between those groups and staff as you can be. And again, I think that's the concern, is like even in a grocery store, there's more than 10 in a store, but people are not going to be next to each other for long periods of time. And again, the more that people can do the socially distance, wear the masks and any other protective equipment, the more they can do that. The grocery stores, the businesses that have made the aisles one way and limit how many can come in or do curbside, I think those are the folks that are on the right track.
Thank you. Quick, I understand that the governor is putting together a COVID task force. Can you share a little bit about what that task force will do, what their vision is, and any additional information or partnership with the business community?
We have just hired an executive director for our recovery group. They will help oversee the funds that are coming from the CARES Act. That is Cheryl Harrison Lee, who was the former city manager of Gardner. So she's got some exposure there to Johnson County. And then Lyle Butler is going to be our board chair. We'll be appointing some legislators. We'll be appointing some other business people. And then one of the other things that I've talked with them, because part of my job as Lieutenant Governor is our Office of Rural Prosperity. And one of the things I've talked about with Cheryl is that we would do regional conference calls similar to this to get feedback and input on how those dollars can be spent and what we need to do. The CARES Act itself has put a sizable chunk of money available to the state. There are some general broad parameters as to how that can be spent on certain things. CEBD G grants they're going to announce some of that today. There's some childcare money in it. There's some housing. We don't have a lot of information yet. We have a 7-page document that came with the money, and we know that there will be a lot of information that we'll have to provide auditors and things afterwards. So we're being, again, careful on that, but that some of that will go out to reimburse cities and counties for some of their COVID expenses. Johnson County, as you know, got about $120 million. Tim can answer that a little bit more. Sedgwick County will have access to about $99 million. And for COVID response, but we know a lot of other communities have spent money for COVID responses. The big thing on those CARES money right now is that it can't go to fill budget revenue holes, and so we'll be looking at that as well. We'll need advice and information on how do we adjust our budget going forward as well.
All right, thank you. We have a quick question. Can you clarify, when will churches be allowed to meet, and maybe what are some of the perimeters around those faith organizations?
Well, faith organizations can meet now under the phase 1. The 10, again, if they can stay socially distanced, 6 feet apart within the church. So, again, a family of 6 can sit together, but they would need to be, 6 feet away from another family of 6, that type of thing. There's some guidelines in terms of deep cleaning and keeping, social distance. I think some of there's some guidelines on, for instance, not passing out bulletins, not collecting, a collection plate, handling that in a different way, so that there's not a lot of interaction with people that way. So they can start meeting, right now, and they're not under the stay-at-home order like they were prior to the phase 1.
All right, I have another question. What are the legal ramifications for when opening a business? I think just as we need to get citizens comfortable going back out, we need to have businesses comfortable, and some of that concern is probably the legal ramifications. Was there some dialogue or discussion that you had in the reopening plan about that?
We have talked about that, and we've looked at that. I know there's also concern on on behalf of a number of legislators in that regard. I do think that, and we've also had some discussions with and seen what other states have done. I believe Minnesota has put together an executive order where, each business has to post their own plan, COVID plan, in terms of what they're doing and how they're doing it. So I think if businesses are abiding to as much as they can to the industry standards that their industry has set up, they're doing what they can to and maintain social distancing and hygiene and cleanliness, and showing that they're doing extra cleaning. Those are some of the things that will be good. I don't think there's been an answer to that hard and fast. I think the businesses that open wide up and have no consideration for people's safety, while there may or may not be legal ramifications, I think there'll be business ramifications, because again, what I'm hearing from a lot of folks is they're still hesitant to go out until they're assured of what it could mean to them personally.
Thank you. Here's a quick question. It's not really related to the reopening, but I think it's one that people always would appreciate an update on, and that is the unemployment insurance and how those are being processed. What's the status of the $600 check that's coming from the feds?
And what's interesting is I've gotten a great education on unemployment in the last few weeks. There's actually 6 different programs that people could qualify for. And we went from about 1,800 claims a week and about 5,000 people that we were sending checks out to over 50,000. It was almost a 15,000% increase for the number that we're handling. I think we're now sending out checks to over 125,000. Tomorrow is the deadline that we set for sending out the $600 extra from the federal government. That actually started on the 6th, so we were about 3 days early. That's going out again. That's kind of on a proportional basis, so much each day for what the system can handle. As you know, the system was originally designed in the 70s, and it's a big mainframe, and we've literally had to program to go from the 16 weeks to the 26 weeks. Then we had to program the $600, and now a team is working on the PUA, which is the pandemic unemployment for the self-employed. We're hoping those will be ready to go next week, but we've had about 30 IT programmers that have been working on that and making that happen. We originally had about 20 people working on unemployment when this all started, taking in claims. We doubled that to 40. We doubled it again to 80, and then we doubled it again to about 150, and then have added another 100 to 150 people to take phone calls that have come in from other places. We're down from the 1.6 million phone calls that we were getting last week. I've not seen the updated one, but there's quite a bit there. We are probably one of the better states where we had a good balance in our unemployment account. About $960 million was in that to start with. We sent out about $99 million in benefits this last week. Now, most of that was the $600 extra from the federal government. So it's not a full $99 million hit to the state plan, but we are monitoring that to make sure that stays healthy and solvent. So we hope that we get people back to work. That'll put less pressure on anybody that has not claimed. They'll still get their back pay. So if they've been unemployed from mid-May and they're just filing their claims now, they'll get the back pay as well as they go forward.
Thank you. Okay, we have another question that came in regards to beauty salons. They're being told only one customer at a time can come in, but if they can accommodate the social distancing spacing requirements of 6 feet, can they have more people come in? And if the state's telling them no, are there some legal issues there that may cause some heartache?
I have not heard the one person per salon question, so I'll have our staff confirm that and get back to you. I guess I would assume as long as those chairs can be 6 feet away, from both the stylist and the customer. The stylist wears a mask, and all the utensils and things are cleaned and whatnot. I think that would probably be the key. But instead of giving you bad answer, I'll confirm that, and we'll get back to you in that regard.
Appreciate that. I think these are obviously businesses primarily located in the Johnson County area, but are curious about any differentials between the rural area and Johnson County. And then you might also comment on the packing house concerns that we've seen in Southwest Kansas. How are those being addressed?
Okay. I would have to say that, as again, my banking background was with ag, so have heard from a lot of my friends in rural Kansas during this period of time, and many of them at the beginning felt like this wasn't something that they needed to worry about. It wasn't necessarily that important. However, I think when Seward and Finney and Ford and Lyons County got hit with the meatpacking plants, many people saw how much it impacted them. And in rural Kansas, oftentimes, people live in one county and travel to a job in another. And so, we have 82 counties that have a case of some kind. And what we've actually been seeing with some of the meatpacking tests that come back, those are some of the folks that have had the virus or whatnot. They had, a few light symptoms a few weeks ago, but they're still carrying the virus. So it has become very real to them and very understanding. And again, part of the concern has been not overwhelming our hospitals in rural Kansas. They're the first line of defense for our Kansas residents. And so, I know in Seward County, they originally allocated 12 beds in their hospital for COVID patients. I think they've now moved it up to 22. They've never been totally full, but it's been dependent on the number of respirators. We used a Black Hawk helicopter to get some additional respirators out last week. So we're making sure that they have the supplies that they need as well. But in my hometown of Wichita, again, many of the patients that are in the hospitals there are from our rural parts of the state. One of the things I think reason our meatpacking plants weren't hit quite as hard as some of them in other states is very early in this process, the governor we called the owners and the managers of those plants and asked them what they were going to do. And they very quickly changed some of their social distancing policy, made sure that people took breaks at different times. They weren't in the lunchroom at the same time. They moved people farther apart on the line. And so that really helped slow it down. And in most of those counties as well, we've also provided some housing where people can be quarantined if they have the virus or if they've been exposed to it, so that they don't take it back to their home, into their community, and share it with family that then spreads it even further. But in a couple of those counties, what we've seen with test results is like 1 in 40 people have it. And so it is a big concern, and we're taking it very serious. Again, it's a major impact to our economy, so we want to be careful, from that regard.
Okay, I want to make sure that we're respectful of your time. I have one final question that came in about what is the plan for reopening the state offices? When do you expect the state to be back at full capacity?
We are in that process now. I know we were visiting with our Department of Revenue on licenses and things. Those are still being done by appointments. Many of those services, again, can now be done online, which is helpful. I expect some of those offices, there'll be plans being announced for those early or sometime next week. We see those coming through. We're starting to see some people, coming back into some of the state office buildings here. We're also looking at what we can and should do for, DCF and KDADs and some of the other departments. So I think we'll start seeing some movement in that regard soon.
Well, Lieutenant Governor, thank you so much for the partnership and being on the call today to walk us through. Please feel free to stay on as long as you can.
Okay.
I know that you have lots of other commitments, but we'd love for you to join as long as you can. And then now we're going to go and look for more of the local perspective. We have Assistant County Manager Joe Connor joining us. Joe, thank you so much. Joe comes from a long history of working with local government. He was originally started with the Wyandotte Unified Government and then joined Johnson County, I believe in 2019, and has served as the Assistant County Manager. So we know that there is a little bit of a slight difference in Johnson County from the state plan. And so we thought it would be a great opportunity for our members to hear where some of the differences are and maybe highlight those areas. I know that are still lots of questions that maybe can be best answered at the local level. So Joe, thanks so much for joining us today. We appreciate it.
Thank you. And I think Tim and everybody at the Chamber, thanks for the opportunity to present today. We always take the opportunity to try to educate folks and answer questions in person when we can. And it's like the Lieutenant Governor said, it's getting harder now because we can't actually travel out to see people, but this is the best technology we have at this point. So I appreciate the opportunity. I want to say also a big thank you to the residents and businesses in Johnson County that have really performed well as far as the restrictions that have been put in place and the things that have happened over the last 6 or 7 weeks. Without that cooperation, we wouldn't be where we're at today as far as hospitals not being overwhelmed, businesses, our essential businesses not being overrun, and the spread of the virus being more than it is today. So just a big thank you to everybody in the community for continuing for the behaviors that we've had up to this point, and hopefully continue that into the future. So these have been extremely hard times, and we all feel it here at the Johnson County government, and we're going to continue to do what we can to provide information and to keep things moving forward. So if you want to go to the next slide. So this is some of the information that we discussed with our at our Board of County Commissioners meeting yesterday. One of the clarifications that we made out with the state was if a business has a question or they'd like a clarification of where they're at on the phase designations, that's a local decision. So, and we're glad to take those questions. So we've got a couple different ways to do that. Calling our call center at 913-715-5000, or we have a COVID email address set up. Either way, if a business has a question about that, we'll take those questions in that way and turn around a response locally. So we are following the state's KEFF framework, with that, but I know there's always some questions about things that are in between there, or just needing a place to ask questions. So, and we're glad to do that. So please use those two ways to do that. On the next slide, just want to provide an update. So as the governor had talked about, there's a lot of resources being developed. And again, we're wanting to use what the state has developed for that. So the address there gets you straight to the business and industry guidelines that's on the state's COVID website. And they've also got links to KDHE, who's issued some specific guidance, in addition to OSHA and CDC resources that are a little bit more broad. And those are what we'll be referring to with businesses. And so I just wanted to provide that kind of information up front, and that way you can get to it now. And and I believe that these guidelines will be updated by the state as things change. There's a lot of unknown when it comes to the virus and how it acts and how we should respond to it. And so as those industry guidelines change, that page will be updated as well. And so that'll be the latest and the best that we know of at this point. A couple of questions I want to try to address at the beginning, and I guess the first question is on the phased in plan for Johnson County. If you look at the graphic on the left, that's similar to what Lieutenant Governor had just shown, and the only difference being is that our first day is Monday, and so we will start with phase 1 on Monday. You can see there the ones that are open and the ones that are closed. This is also located on our website as well. We have a lot of resources for COVID-19 updates, and so this will be our reopening plan. And then the second graphic there is what I just had talked about. If you need to have any clarification from businesses, please refer to those telephone numbers. So the one of the other questions that was asked me ahead of time was how does our reopening plan compare to the metro area? And you know, in reviewing the Wyandotte, Johnson, Jackson County, and Kansas City, Missouri, basically, there's not a whole lot of difference. I would say that in Wyandotte County, their phase 1 is going to be more restrictive than our phase 1, and same with Kansas City, Missouri. Jackson County just came out with theirs yesterday, so I didn't have a whole lot of time to review their phase 1, but it seems fairly similar to ours. So you're not going to have consistency across the metro area, but you will have you know, kind of the reopening movement starting pretty much at the same time. So again, that's kind of the best information that we have at this point. One other question that was asked ahead of time was about enforcement, and you know, we've fortunate in Johnson County to have a very coordinated law enforcement community. The Johnson County police chiefs, as well as the sheriff, have met on this issue with our district attorney back in March, actually, and developed a good coordinated system that basically focuses on education. And so I know there's been a lot of education done by the police departments and the sheriff with businesses as they have had questions. To date, there's been no tickets issued. There's been no criminal actions taken. And so again, we're very fortunate in Johnson County to have businesses that are very responsible when it comes to dealing with this virus. Moving forward, that partnership with the sheriff, the city police chiefs, and the DA will continue. They remain in constant communication with these issues. We were on a call yesterday with the city managers. We have a pretty regular meeting with them every week. There were very few city managers that talked about businesses that had already had opened this week, and so there's not a lot of contentious issues that I know of at this point, with business and enforcement. So again, the education will be the key, and they'll continue to do that. One other question ahead of time was, I think the Lieutenant Governor talked about PPE and assistance for businesses trying to open and trying to get access to it. We continue to struggle with that here at the county, and our main focus has been PPE for our public safety, for hospitals, and for long-term care facilities. And while we do have some supply, we don't have an abundance of supply. So we will not be able to provide assistance to businesses at this point. We can, offer some suggestions or some guidance, but we will not be able to provide any supply because we want to maintain our core level of supply. We're not able to do that. I shouldn't say sufficiently, but consistently. We're still concerned with the supply chain for our operations. I think the question about the second wave, I think that Lieutenant Governor addressed that fairly well. We will be trying to stay extremely close to the state as possible, because what their plans generally dictate is what we'll have to follow. And so I was glad to hear the Lieutenant Governor say that. The one thing that we do have in place is a very robust data collection system. And again, on our coronavirus website, it's jocogov.org. And then you can click on the coronavirus tab. We have daily updated data around cases, hospitalizations, EMS calls, long-term care facilities, and some other kind of variations of all that. And so it's available out there now. I'd encourage you to use it. If you have any questions about it, you can please let us know, and we can try to help you understand it. But it's fairly straightforward, and we're pretty proud that we have that. We do have we're very fortunate in Johnson County to have a very good testing program in place. Our new health director, Dr. Sami Areola, actually was scheduled to start on March 23rd, and he got in town on March 16th. He traveled from, we recruited him from Nashville, Tennessee. He actually started on March 17th. So he was literally got into town one evening and started working the next day. So we're very fortunate to have him and his expertise here. And he recognized early on the need for not only testing those that are ill, but those that aren't ill, so we can start to get an understanding of where we're at as a community with the spread of the virus. And so if you look at the statistics that we have out there right now, our based on the total number of tests and total number of positives, we're at about a 7% rate. And so we expect that number to be a key indicator moving forward as the phases start to open up, and as we continue to do our random sampling testing, we will start to be able to track, hopefully as quickly as we can, the spread of the virus and what actions need to be taken going into the future. So we're very fortunate to have have that in place and be kind of ahead of the curve when it comes to a lot of other local communities. And then we do have contact tracing set up. Again, I think we need more capacity for that, but we do have a system in place, and we fully expect to be able to enhance that. Again, the governor talked about volunteers and some contracted workers, and actually adding some additional staff going into the future. We expect to be doing this for quite a while, and one of the things that the public health experts talk about is, you really need to have a good vaccination program, or to be able to establish, through your community testing, that we've got immunity built up, within Johnson County residents. So that's going to be a while, but we're starting down that path now to be able to try to track that. I think those are all the questions that were kind of asked of me ahead of time. I think that I would stand for any additional questions. And again, I can't thank everybody enough for the opportunity to talk with you today, and to also thank you for your support and continued support as we start to reopen the county and start to have people come out of their homes on a more regular basis. We're all looking forward to that. So with that, I'd stand for questions.
Yes, we are, Joe. Thank you. As a mother of 4 children, I am anxious to get opened up again and start getting back to daily life. And so one of the questions that came in, I think a lot of people are wanting, is some clarification on sports and perhaps sports venues, those organized. Can you go a little bit over what the requirements are on those, the phases they fit in, and maybe any discussion around sporting events, both arena style, but also the outside youth organized sports?
Sure. So the youth sports and youth sports venues are scheduled for a phase 2 opening. And if you look at that chart, really in phase 2, once we open in phase 2, there's not much left to reopen other than the very, very large type venues. So we want to be extremely cautious once we start phase 2, because one thing that we've heard loud and clear is that nobody wants to go back. We want to make sure and do this, as efficiently as possible, but we also want to do it cautiously. So according to the phased in plan from the governor's office, the youth sports will start no sooner than May 18th. And then the venues have guidance that they're supposed to be working on as far as reopening up for tournaments and things like that. So we expect, again, for phase 2 to begin practicing, and then tournaments to start to be scheduled, and the venues can start to reopen and start to schedule tournaments again.
Well, that's good news. Another question that came in that I think is probably one that you've had a lot of discussion and dialogue but that is weighing the balance between public health and our economic health. Can you talk a little bit about that and the balance that you at the county level have tried to strike?
Yeah, so thank you for that. That is the question, and honestly, it's a policy level question that is very, very difficult to answer cleanly. And that's been a really high level of frustration, I think, amongst not only the public health medical community, but also, with the elected officials and policymakers. And, trying to strike that balance is important. And, I think the thing that our local health officer has been looking at is not only what's happening in Johnson County, but what's happening in the metro area and what's happening with the state. And because especially with the level of healthcare that's provided in Johnson County, if folks from Western Kansas start to flock to Johnson County for hospital beds, that'll affect our capacity to respond here locally. So, so that, there's not an exact formula for that. There are a lot of metrics that we look at, and there are being looked at every day, and a lot of investigations that are happening. And so far, we've been fortunate to be able to look at what I consider outbreaks, and really they're limited to the long-term care facilities at this point, and be able to do the investigations, the contact tracing, and getting that turned around fairly quickly.
Can you at all talk about the funding that Johnson County received directly from the feds and how that money will be dispersed amongst the cities and other partners in our county?
Sure. So again, as the Lieutenant Governor said, this money was allocated, distributed, and did not provide a lot of guidance for us. And so we have not spent any of the money yet. We know it's for COVID-related expenses, and we know that generally what it can be used for. But we were looking for some additional guides to make sure we're doing this appropriately and not making any mistakes. So anyway, there's more guidance that keeps kind of trickling out of Washington D.C., but we don't really have what we consider final guidance yet to try to move forward. As far as distributing to the cities, again, that's guidance that we're looking for. We've kind of been told that the counties receive allocations across the country for the county services, and that the states have a pot of funding that cities may be able to apply to, for their COVID-related expenses. So again, we need to figure out what rules are we playing and what parameters do we have, because right now it's not real clear what we're supposed to, what rules we're supposed to play by.
Like the state, will the county be setting up a task force then to maybe work through some of the direction and how those funds will be dispersed and used?
We haven't talked about that specifically, but I think, again, once we figure out what rules we need to play by, we'll figure out a way to figure, how we're going to, what we can utilize the funds for, and what's the best way to do that. It is an awful lot of money. Nobody's going to deny that. But quite honestly, there's just a high level of anxiety about having that much money, not knowing what to do with it. So once we can get a little bit more comfortable with that, I think we'll be ready to come up with a game plan.
Can you talk a little bit about the education system, both the K through 12 as well as the higher ed, and how the county will assist with getting those reopened?
Sure. So we've been on, we just were on a call last week with all the school superintendents in the Archdiocese last week, talking about that particular issue. They were worried about summer school was their first kind of concern, and the second was a fall opening. So at this point, we just had some initial discussions about schools and about the K through 12 schools, and hoping to get some additional guidance from the state on that, the Board of Education specifically, to help the schools come up with their plans on how they want to open. We're certainly going to be supportive of their efforts and provide them with all the resources and information that they need to help make good decisions. And again, we're fortunate to have a group that works closely together anyway, and so this has been just a natural evolution of discussions with them. And so there's been no decisions made yet, But I know that we will continue to meet with them and come up with what the game plan is going to be for, especially for the fall.
Excellent. Can you talk a little bit about the phases again and each date that's been set? Johnson County obviously has the authority to delay from the state. How will that be communicated? How will businesses know when we're ready to move into the phase? Will we meet that date that's been set?
Sure. So, I mean, first and foremost, we do have to make sure and follow what state guidance is. And so I know they've put a May 18th date out there. I guess I would just make sure and understand that that's a not before May 18th. And so as the Lieutenant Governor said, they have not even, and they're going to start looking at data next week, you know, for what the statewide decision will be. We're doing the same thing locally. And so we will start reviewing that. We've been reviewing that data all along, and we'll start having more serious discussions about it. But we certainly need to follow what the state says first. As far as communications goes, we want to provide as much time as possible so that businesses can get ready and can start to open as soon as they can. And we understand for some there's a fairly large ramp up time to get started. You know, bring people back. Make modifications to facilities and so on, and your procedures and so on and so forth. So we completely understand that. And so the communication will come through our public information office. We'll do as much as we can with media and with other forms of putting the information out. Our Board of County Commissioner meetings have been very informational. And then we've got our COVID website page, our coronavirus website page that has a lot of information on it. So we'll do the best we can to try to get that information out as soon as we can so that businesses can plan. And we certainly understand the need for them to do that.
Well, Joe, thank you. I think that that's a great note for us to wrap this up so we can get everybody back to their Fridays. Businesses love certainty. So thank you for the efforts that you have done at the county and being able to help us maneuver this storm. It's definitely one that we will all remember. But I do believe with partnerships and communication, we can continue to make our way through it and get to the other side. I'm going to turn it back over to Tim. Again, though, I want to remind everybody we have recorded this session, so you will be able to view it at a later time. And just thank again, Lieutenant Governor, for joining us. I think he had to hop off, but appreciate his time as well as yours, Joe. Thank you so much.
Oh,
Tim, back to you.
Anytime. Thank you.
Thank you, Natalie. Thanks for moderating. Thanks, Joe, for being here. And once again, I'd like to thank the Lieutenant Governor. A couple of items, as Natalie said, this will be posted on our website, the recording. We will also have the slides on the website as well, so you will be able to see all of the information that was provided for you today. One other issue, Joe did bring up the issue of PPEs. As many of you know, we sent out a survey to all of our members to find out if you were providing or producing any PPEs. And we have on our website a list of companies here in Johnson County, in Olathe, not only in Olathe, but throughout Johnson County, that are our members that are producing PPEs. Obviously, we want PPEs to go to our frontline workers first. Our hospital and our other people that are helping to fight this, but we understand that our businesses may need PPEs as well too. So there is a list on our website. If you go to our COVID page, there's a list of companies that have stated that they will or they are selling or providing information. Materials for our businesses. So please take a look at that. But once again, we are here to try and provide information to you and our businesses. So we'd like to thank everyone for being here today. Please stay safe. And we are looking forward to getting back to normal and opening up our businesses as soon as we can. So thank you very, very much and have a wonderful day.